There we go.
All right. So the parotid gland is on the outside of the face between the ear and the masseter muscle. The other two salivary glands are best seen on this model. This is the submandibular gland, which is more lateral and more inferior. Sublingual gland is more medial and superior under the tongue. Submandibular is under the mandible. Then we move into the oral cavity, which is the fancy term for the mouth. So the hard palate is where the bone is present at the roof of the mouth. The soft palate is the soft tissue just behind the hard palate, so kind of at the corner where this is turning. Here is the soft palate, and then this is the uvula, which is the hangy-downy punching bag at the back of your mouth. The tongue, what else is in here? The lingual frenulum is the tissue that connects the tongue to the bottom of your mouth, which I can only ask you about on the pig. The pharynx is the entire space between the top of the back of the nose and the beginning of the esophagus, which is this tube here at the back. So the nasopharynx is the top region at the back of the nose from the top down to the uvula. The oropharynx is the space at the back of the mouth from the uvula to the epiglottis, which is this big blue diagonal piece of tissue. Blue represents cartilage. So oropharynx from the uvula to the epiglottis, and then from the epiglottis to the beginning of the esophagus is the laryngopharynx at the bottom. The epiglottis, again, is this flap of blue cartilage covered in tissue. The esophagus is this tube that is behind the larynx, the beginning of the respiratory passages, back here. And if we switch to the big model, let me see. So the esophagus is this tube at the back, and then it shows it go all the way down to the stomach. The tonsils, the palatine tonsil is lateral in the oropharynx. So it's shown at the back side of this model since we're looking at it sagittally. The lingual tonsil is on the back side of the tongue facing the oropharynx on the front. So it's the anterior of the oropharynx. And then the pharyngeal tonsil or adenoid is in the nasopharynx. The thyroid gland sits on the front of the trachea, just below the larynx. So this model shows half of the thyroid gland, and I'll show you what the thyroid and the thymus look like in the pig. The teeth. Is that okay? Yeah. Here's the central incisor. Next to that is the lateral incisor, and the canine or cuspid. Then the first bicuspid or first premolar, second bicuspid or second premolar, first molar, second molar, third molar. The third molar are the wisdom teeth, and not all of the models have them. So be sure to count at least molars or check all the teeth if the last one is marked. I'll pick back up on the mesenteries another day. The stomach, the constriction where the esophagus enters the stomach is the cardiac sphincter. The region right around the cardiac sphincter is called the cardia. The region at this superior corner is called the fundus. The main region of the stomach is called the body. And then where it turns the corner over here is called the pylorus. Surrounding the pyloric sphincter, which is the connection between the stomach and the duodenum of the small intestine. The ridges on the inside of the stomach are called rugae. So the duodenum is the first region of the small intestine, shown all by itself over here. The jejunum is the middle region, which I won't ask you on the exam. The ileum is the last region of the small intestine. The cecum is the part of the large intestine that extends down past the ileocecal sphincter, which is the constriction that connects the small intestine to the large intestine. Vermiform appendix extends off the cecum. The cadaver had her appendix removed, so there's no vermiform appendix to find. Ascending colon, transverse colon, descending colon, sigmoid colon, rectum. The Tenei coli is this ribbon on the colon, and a haustrum is one of the bulges created by the Tenei coli. The internal anal sphincter is right in the wall of the rectum and the anus, and the external anal sphincter is lateral to that. It's skeletal muscle on the outside of the wall of the anus and rectum. And then the accessory organs, this is the liver, gallbladder, this is the spleen, this is the pancreas, shaped like a pennant flag, this is the duodenum. So the pancreatic duct runs through the length of the pancreas, kind of this middle branch looking like a feather. The last branch off of that pancreatic duct is called the accessory pancreatic duct. It has its own connection to the duodenum. Up at the liver, these green tubes are all ducts having to do with bile. So this is the left hepatic duct, the right hepatic duct, common hepatic duct, cystic duct, and then the common bile duct. Common bile duct connects with the pancreatic duct, and they have a shared connection to the duodenum called the hepatopancreatic sphincter, which you can also call the sphincter of Oddi.